Thank you very much for joining us. Now, we'll be having the questions to be addressed to each of the doctors as we deem fit. So we'll be going through one by one. Now, first question goes to Dr. Wee. Now, Dr. Wee, now weight control, especially belly fat. What do you do to control them, and how do you prevent muscle loss through perimenopause and menopause?
Right.
It's a loaded question.
This is a very common question in my clinic. So personally, I feel it too. So once you hit 40, I think it's really hard to keep the weight down. I think your metabolic rate kind of reduces. So cutting down on your carbohydrates, I think is important. I know you need to have a balanced, healthy diet, but carbohydrates are a culprit. At the end of the day, it's calorie intake and output, isn't it? And you need a calorie deficit if you want to lose weight. So I think cutting down on the carbohydrate, make it nutritious by having more protein, have lots of vegetables and fruits, and exercising, right? You want to kind of increase that calorie output. So do that 8,000, 10,000 steps a day. If you've got a watch to track, that would be great. You do? Good. Good for you.
1,000. 9K more to go.
You got a lot to go. And I think in the exercise, it's not just running or cardio. I think it's also really important for ladies going to menopause to build muscle strength. Strength training is so important. So hit the gym, get a good personal trainer to actually teach you all the good exercises to build upper body strength, leg strength, and so they can do it safe and effectively. And having muscle around your bone is also good to protect you against falls, right? As you know, osteoporosis becomes a risk as you reach menopause, and having that muscle to protect your bone actually reduces your fracture risk. And also once you're menopausal, make sure you take your calcium and vitamin D, as what Ivan was saying, so that you can reduce that bone density loss. What else? I think for strength training is also important if you want your muscle to recover quickly. Magnesium I super love magnesium as a longevity drug. I think creatine is also really good. And I think the belly fat, even I still have it. It's a childbirth thing, right? And as you grow older, you cannot see. As you grow older, it's just very hard to get rid of. So what I'm trying to say is we need to set ourselves goals, but we also need to be pragmatic about it. We need to manage our expectation, have that goal stepwise ahead so that you can look forward to it. And every step you reach is a win. Yeah.
That's a great answer. Thank you very much, Dr. Wee.
Yeah.
Great answer. All right, now the next question goes to Dr. Chua. So the denosumab injection, the zoledronic acid infusion are treatments for osteoporosis. Please share the risks and the benefits of these treatments.
I have shared the risk inside my talk. They are actually different drugs. Zoledronic acid is a bisphosphonate. Primary action is to stop bone from clearing away. It's an anti-resorptive. Denosumab is also an anti-resorptive, but it has also weak anabolic, meaning build bone properties. I would say the efficacy of denosumab over time is far greater than that of zoledronic acid. Why? Because zoledronic acid if we do start, we give it for 3 years, and we usually expect lumbar spine bone density gain by about 7 to 9% max. Whereas in denosumab, we can give it, current data is at 15 to 18 years and very safe. The density just keeps going up. So if we all think if we do start the bone density T-score from a very, very negative means no good. The more negative, we have to use a drug which lasts, we can give for longer periods of time, can raise up the bone density a bit faster, so that in the end, the net result is to decrease your risk of having a fracture. So the risks are actually fairly similar.
Thank you, Dr. Chua. All right, next question goes to Dr. Huang. Now, sir, how to correct and reduce or eliminate neck and back pain from years and years of desk work and suboptimal posture? Can you reverse that? Can you reverse all the damage that has been done?
Well, I think at the end of the day, you got to start now. right? If you have been doing this for years, you know that it's bad postures, then I think first thing first is try and see whether ergonomically you can change anything. Change your work desk if you need to. Your workstations need to be perfectly suited to your individual needs. So really the monitor needs to be at your eye level. You have your elbows at 90 degrees when you're actually working, your feet on the ground. And this thing needs to be adjusted to your own personal height. So everybody is a bit different. And sometimes due to workplace limitation, of course, it's a bit hard to achieve that. So you need to move. And I would generally advise that every 45 minutes, you get up and start moving around. I shared just now that motion is lotion, mobility is key. So I'm going to say that again. So basically just keep moving. And I think your muscles, your body, your joints, and your ligaments, your body needs that, the motions to keep the blood circulating and the oxygenation to reach them. And this will give you good, healthy tissues, and therefore it will eliminate pain. And of course, besides moving, of course, you can also do few simple things like stretches. So it's a double S. You stretch yourself, you stretch your contracted muscles at the end of the day or after a prolonged seated position. You also need to strengthen after that. So stretches and strengthening helps over the long run. And when I say strengthening, it actually really means strengthening your core muscles as well as your spinal muscles, so that these muscles can actually take the load of the spinal structures itself, and it prevents damage to the inherent nerve elements that you want to protect. So yeah.
Thank you, Dr. Huang. Now, motion is lotion. I love that. Now, sir, can I ask you, just for fun, take a look at all the people sitting down. Who has the best posture? Dr. Ivan has been moving for the past 5 minutes.
Yep.
He hasn't moved. He should move.
I guess for 5 minutes, I would say Ivan has the best posture.
But he hasn't moved at all.
Well, we give him a limit of 45 minutes, right? So he actually has a very good posture.
Yeah, he has. Okay, now the next question. All right, Dr. Wee, at different age stages of women, now can you list out the type of health screenings, diet, and exercises we have to take at different stages?
Well, that's a very big question. So I'll just start with health screening. So pap smear for cervical screening, that starts at 25, 26, and it goes on to 69. And then we also have mammogram, which is to screen for breast cancer, that starts at 40. But if you have a family history of breast cancer, you start 10 years earlier than the diagnosis. Younger ladies before 40, usually we do ultrasound breast to screen for cancer because of the density of the breast. Above 40 will be mammogram, and 40 to 50 will be yearly, and after 50 will be every 2 years once. But if you're on HRT, that will be every year. Now, what other health screenings we have? We've got all the blood tests, ovarian cancer profile, which includes the CA125, and that screens for ovarian cancer, although 50% of stage 1 ovarian cancer has a normal CA125, which is an ovarian tumor marker. What are the health screenings we have? BMD to screen for osteoporosis. Those are the ones that are common in terms of screenings. And of course, all the blood tests, right? To screen for diabetes, screen for high cholesterol, that we have commonly in our health screening packages. Diet-wise, I think a balanced, healthy diet for sure. When you are pregnant, you are not eating for 2, you're eating for 1 nutritiously. You do not need extra calories in the first trimester. In the second trimester, you need an additional 150 to 200 calories per day. That's not much, is it? And then in your last trimester, you need about 250 to 500 calories per day extra, depending on your size. So that's diet. And of course, when you're menopausal, remember your calcium and vitamin D, important for your bones. Anybody menopausal, I always advocate multivitamins.
That's great advice. That's great advice. And by the way, you were saying if you're a pregnant woman, you eat for 1, not for 2.
Exactly.
Is that true? Hang on. If my wife is watching this, you need to hear this.
So you can tell your wife this. You can tell your wife this. You're not eating 2 bowls of ramen when you go to Tokyo. You are eating a bowl of ramen, but you add the char siu, you add the egg, you add the, nutritious stuff in to make
There
it
you
more
go.
nutritious.
There you go. That's a very
Yeah.
wise answer. Okay, now the next question. Next question goes to Dr. Chua. Dr. Chua, is it beneficial or necessary to take supplements like glucosamine, calcium for bone health, knee pain? How to prevent it? This so two questions. I know some people, they swear by glucosamine. Now, what are your thoughts?
Two parts. I can answer. I take this into two parts. I think in my talk I didn't cover the supplements in detail. For calcium, good for bone, good for supplementation because our diet is not enough calcium. 600 milligrams to 1,000 milligrams of additional calcium a day will be sufficient. Don't be afraid of kidney stones, heart problem. If your kidneys are functional, healthy, you don't form any kidney stones at all. So you need that additional supplementation to fill up what you can't take from your diet. Glucosamine for joints, well, it is I will classify that as a myth. Everybody likes to take it. A lot of doctors like to give it. Why? Because there is a placebo effect, and it is real because this has been proven in studies more than a decade ago that glucosamine has not been shown to have a positive effect on reducing joint pain and preventing arthritis. And it's nothing more than a placebo effect. So on calcium, 600 to 1,000 milligrams of calcium a day. Additionally, for vitamin D, at least 600 to 1,000 IU of vitamin D a day. That should get you through.
Which means, like what you said, 30 minutes of sunlight as much as possible.
Yes,
Every
30
day.
minutes is actually very hard.
Got it.
Even my vitamin D is low.
Oh.
I am taking vitamin D supplementation.
Mine too. My vitamin D is low too.
And
really?
And it's
Okay.
very consistent. I had a couple of vitamin D checks in the past few months. If a period I stop my vitamin D supplementation, I'm indoors, our profession is indoors. Vitamin D level drop. So don't be surprised, head to your GP, check your vitamin D, it might be low.
I think we're too hardworking.
Yeah, you could meet your patients outdoors, right? That will help. All right, now the next question. Dr. Huang,
Yes.
now what tests can help early detection of bone degeneration and disc compression leading to pressure on nerves?
Wow, for the friend, our buddy that's asking this question, I'm very sorry. It's almost definite that your bone is undergoing degeneration, so I don't think you need any test for that. All of us are aging, so it's really hard to tell. I mean, there's no need for a test that actually predicts early bone degeneration. But I think what he's trying to ask is whether there's anything that's telling us whether the nerves are actually at compromise. Typically, in our medical world right now, we actually go by symptoms. So really, we look at whether you're having actually any nerve symptoms, any sciatica or radiculopathy from the upper limbs or lower limbs, and then we decide whether clinically we need to actually further investigate. And I think the gold standard for detecting nerve compression in the spine is still an MRI scan. Of course, there are some patients that cannot undergo MRI scans, then we'll consider CT scans. But by and large, MRI scan is still the mainstay, and it's generally safe because there's no radiation involved. The only issue is the cost of it, and of course, get your insurance.
There you go. So MRI, so the gold standard. I see. Okay, so next question, Dr. Wee. I think this is a common issue. How do you address postpartum issues during early 30s for the second child? Recovery always seems to take a very long time with work stress. What do we do, Dr. Wee?
Well, I think it depends on what the postpartum issue is. If the postpartum issue is postpartum depression, then I think you really need to seek help from a psychiatrist because we need to talk out the issues, and possibly you may need some medication and antidepressant to tie you through the period. But if the postpartum issue is because it's tiring and it's difficult to cope, I mean, you are Wonder Woman. All us mothers are Wonder Woman, right? Yeah. And I think it's even worse because you have a second child. That means you have a first child who's a toddler. And so it's difficult to juggle toddler, baby, and at work as well, right? And you're probably breastfeeding. Breastfeeding takes a toll. You're not having enough sleep because of the baby crying. And you have to go back to work, tired and pumping your breast. I think it's tough. So you are a Wonder Woman, whoever is asking this question. And even Wonder Woman needs to ask for help. And you need to ask for help to have a personal mean time to take care of yourself. It takes a village to look after 2 kids. And what I'm trying to say is not because you can't cope. We're all Wonder Womans, right? You are asking for help and you're asking for self-care and rest so that you can be a better Wonder Woman.
Also, a perfect answer, really. And
Yeah.
a shout out to all moms. We all are Wonder Women, really. So really, thank you very much. A great job done. Every day should be Mother's Day, all right? Right. So the next question, Dr. Chua, are there any side effects for osteoporosis patients who receive calcium injections? Now, this is something we hear since many years back. Could their bones become brittle or fragile after taking so many injections?
I'm not sure what background this question came about. We don't give calcium injections. Why? Because the calcium in the blood is actually very, very tightly regulated. If we give additional calcium by the blood, it could raise the blood calcium to a dangerous level that can affect the heart rhythm, muscle function, or even the gut function. So calcium is better taken oral, so it's slow. We have the effects of hormones to buffer the uptake and so that we don't get too high calcium in the blood. I don't think if in the setting of someone who is receiving calcium injection for low blood calcium, I don't think it has any effect at all actually.
Thank you, Dr. Chua. Thank you very much. Now, next question, Dr. Huang. Now, the area below the neck at the back center feels achy from time to time. What can I do to release and strengthen? And which area is that? The area below the neck at the back center. Here we go.
I think what he's trying to ask is actually basically neck pain and maybe upper back pain, which is actually very closely related. This area is actually where your rhomboids and your trapezius are. And if you need to stretch it out from time to time, you have aching. Releases actually done in many ways. James over here actually has a massage gun that maybe he can share with us.
Yeah, I do.
These massage guns are actually easily available in the market right now. It's getting very popular. Some of the physical therapy centers actually already have them. And they come in all shapes and sizes with really funny attachable knobs, and it allows you to do it for yourself actually. You have a curve attachment that allows you to just massage your back. These are actually quite useful as a trigger point release where you actually apply pressure. If you don't have that, or if financially you're a bit constrained, you can actually use a roller ball. Any massage ball, you put it on the wall and you just press against the tender spots, and that will also help with the muscle release. With regards to strengthening, what can we do to strengthen? Before I jump to strengthening, another kind of release that you can actually do, you can try dry needling, but of course get a trained physical therapist to do that, or things like acupuncture can actually help to release muscular tension. Go to a proper TCM practitioner. And then we go to strengthening after that. Now, how do we do strengthening? I think one of the most simple exercises to strengthen your upper back and your neck will be what we call the YWT, YTW. So you just basically lie prone on the ground and you basically do like a swimming action. So you go for a Y, a T, and a W with your upper back elevated. So that's actually strengthening
Shall
the
we
back.
have a demonstration, please?
Not in the proper attire.
So Dr. Huang is actually endorsed massage gun. So you see that online from time to time, and the prices are getting cheaper now. So massage gun can help from time to time. Yeah.
Don't overdo it.
Don't overdo it.
If you still have a lot of pain, come and see me first.
Don't take over his job, okay? Yeah, here we go. All right, now the next question. So the next question, Dr. Wee,
Yes.
we're talking about a small frame lady in her mid-50s. Family history of osteoporosis and is herself osteopenic and worsening BMD. Is hormone replacement therapy advisable? Is there any kind of risks?
Well, I think it depends on whether she's got other types of menopausal symptoms, right? I think because HRT itself has many risks, as you saw from my slides. Important risks like breast cancer, increased risk of cancer to the womb if it's not protected properly, increased risk of stroke, forming clots in your legs, increased risk of gallbladder problems. So it doesn't come without any risk. If her main problem is being osteopenic, she should go and see Ivan. No, but of course, it's well known. HRT prevents osteoporosis. So I think it's not an easy answer to this. We need to sit down with her and see what she wants and what she needs and decide
like what you
accordingly.
said, everyone is different. We need
Exactly.
a customized plan for every individual.
Yes, that's
I've been
right.
listening to you.
Good.
So here you go. So next question, Dr. Chua, prevention tips on how to manage osteopenia.
Actually leads to this question. Osteopenia prevention. 4 things. Number 1, stay active. Stay active. Exercises, 3 types of exercises. This is like I explain to my patients: weight-bearing exercise, resistance exercise, and cardiovascular exercise, aerobic exercise. So 3 things, 3 exercises. Number 2, calcium. Adequate calcium intake. Number 3, adequate vitamin D intake. And number 4, protein intake. Adequate protein intake. So you combine all this. These are 4 ways to manage, to improve your bone and muscle health. So if you're osteopenic, don't fret. Your aim is to maintain. Okay, is to maintain, not to start treatment. Your doctor may score you your fracture risk on using Frax. If it's low, if it's high risk, may decide after a thorough discussion to put you on treatment because to treat the fracture risk. But generally, our local doctors will start treatment only if the T-score is negative 2.5 and below. So if you're osteopenia, don't fret. Just do these 4 things.
There you go. Very wise and balanced answer. Thank you very much, sir. Okay, the next question. Next question is Dr. Huang.
Yes.
Someone's interested to know more about improving backache and aching on the sciatic nerve.
Okay, I'm guessing this person asking is having some sciatica and some back pain issues. I think in the acute stages when you're actually experiencing pain and especially when you have sciatica, you can take a day or 2, just to have complete bed rest and take some medications. But what we actually advise patients is really to get up and move around as soon as they can. And that has been proven that it will give better results in the long run. When I say getting up and moving around, what do I mean? So basically, I allow them to walk. Walking is the best form of exercises. Maybe not 8,000 to 10,000 steps a day, but maybe we go with easy 2,000 to 3,000 if they can. And then after that, I tell them that they can try and swim if they want to. And all these are actually extension-based exercises. We try and avoid a flexion posture because a flex posture actually worsens, a slip disc, and then it causes more nervy symptoms. When you walk, of course, if they tell me that, oh doc, I can't even walk, I take a few steps, I'm in pain, then it'll be great if you have a swimming pool. If you have a swimming pool, you walk in the pool. The water will actually offset your body weight and gives you some support as well. Static exercises that you can do, usually just nerve flossing at the start. Nerve flossing, what do I mean by that? Really, it's a flossing of the nerve, of the sciatic nerve. You can actually Google that. There are a few ways to do it. Generally, you lie down and then you move slowly. You move your knees, your hips, and then your ankles. And then slowly you couple it with your neck, range of motion, and that will give you symptoms relief over the long run. And finally, you can add in some medications. There are a lot of neuropathic agents that help with nervy pains. And this conservative period that you're doing usually lasts for about 6 weeks, and you see whether there's any improvement. And if there's no improvement, then it's time for further interventions and investigations.
It's a great answer. Thanks, Doc. Thank you very much. Now, I think one thing we can take away after listening to you is to really move more than you can. Right, as much as you can. Movement is great for the body.
That's right.
Right? Okay, we'll. It's a great reminder for me as well. Okay, I think we have 4 more minutes to go. Let's see how much we can cover. The next question, Dr. Huang, or rather Dr. Wee. Now, how long will perimenopause symptoms persist? Is there a way to handle perimenopause? I'm not going to say everyone's different.
Everyone's different and thanks for listening to my talk. Okay. So survey has shown that in the Western world, 7 to 8 years average. In Asia, actually shorter. So I think Asian women are either more resilient or people still see to it that it is like a taboo to say that you're suffering and seek help. And yeah. So in Asia, it's reported as about 2 to 5 years, so slightly shorter. How to deal with it? I think I've already spoken in my slides. Balance healthy lifestyle, exercise, take care of yourself, have plenty of rest, reduce on the caffeine, reduce on the alcohol, take up a hobby, being insightful, have the family support, your husband's support, and also that people understand you're going through a transition. And if all that doesn't help, come and see me or a gynecologist whom you trust, so then we can discuss treatment like HRT.
Oh, that's great. Great answer. Great answer. All right, now next question. Dr. Chua, can we cure osteoporosis, and how much are the screening charges for osteoporosis? Or ballpark?
Cure osteoporosis actually is reversing the bone density, the poor bone density. I presume that is what you mean by curing. So we have to have treatment. That means they put on medications in order to reverse that. Sometimes one medication over a few years is not enough. We can't sequence the medication so that the bone density can be reversed. Screening charges for osteoporosis, actually one consultation plus one bone mineral density scan. I think nowadays bone mineral density scan is about $250 to $300. If it's cheaper if you do in a polyclinic, but in a private setting, it's also equally affordable.
That's very helpful. Thank you, sir. Okay, the next question, Dr. Huang, how do you care for slip discs? Like if I have an issue, how do you care for it?
I think we touched a bit on that just now, which is basically symptoms of sciatica and what to do at home. I'm going to just touch a bit on what not to do then. Basically, when you have a slip disc issue, if it's giving you symptoms, generally, I would say activities, we need to have a bit of alteration. No high impact stuff. Tell them not to go for runs, especially long runs. If you like sports, things to avoid is really things that has a lot of jumping. I would guess basketball, badminton, even tennis sometimes can aggravate symptoms. And finally, one of the worst sports that to really engage in at this point in time is really things that cause pivoting of the spine, and that would be like golf, which is why Tiger Woods has 3 times spinal operations before. So these are the activities that I'll try to tell them to avoid. Take the medications and then do the exercises that we spoke about just now, and the symptoms doesn't get better. You notice that you're getting weaker, the symptoms are worsening, or you actually have problems controlling your bowels or your urinary action, then this is a time to actually seek medical professional opinion.
Thank you so much, sir. Thank you. All right, now, ladies and gentlemen, well, we thank everybody for your lovely questions. Now, we're sorry we couldn't get to every one of them due to time. We greatly appreciate you spending your lunchtime with us, and we hope you truly find this webinar useful. We all did. Now, once again, a heartfelt thank you to Dr. Wee, Dr. Chua, and Dr. Huang for taking time to share such valuable insights on staying healthy today while protecting your tomorrow. So, well, before you go, I would love to have your feedback on today's webinar via our survey by scanning this QR code. Now, the first 20 of you to provide feedback is going to walk away with a $10 Grab voucher. All right, so please, share with us what topics you'll be interested in for future webinars so we can keep a lookout for you. Please do scan the QR code. Your feedback is important for us. Right now, once again, we thank you very much for your time. We'll be flashing the details of our speakers in just a bit. This webinar is brought to you by iXchange, your trusted TPA and medical services provider. Please email us if you do have further inquiry after today's seminar. All right, at this moment in time, I would like to thank the doctors again for joining us. Let's give the doctors a big round of applause. Thank you, doctors. Thank you very much. All right, so thank you, everyone. We hope to see you again very soon. Have a great week ahead. Bye-bye.